Our next question is about the Azure category and if you can get SBRT in Azure. So can you actually break down what our Azure category is? We have a prostate cancer staging system, and that's high risk, but can you kind of give a breakdown of what the case is?
Well, high risk sort of says it all. High risk means Gleason 8, 9, or 10, PSA above 20, a large lump in the prostate that may be coming out the edge of the gland. And SBRT, stereotactic body radiation, is a convenient new way to give beam radiation over a short time period, usually about 10 days, as opposed to 5 to 8 weeks, which is the more traditional IMRT approach. And it is possible to give SBRT to people with high-risk prostate cancer with the Azure category. It certainly depends on the experience of the center that's giving the treatment. So I don't think, like with any newer type treatment, patients don't want to be in the learning curve of the facility where you're the first one that they've ever done SBRT treatment in. Doctors can use the same equipment that IMRT is done with, where they go in and get a smaller dose of radiation over a 5-6 week period, and they can just switch the dials and they can get a big dose every other day for 5 treatments, total of 10 days, and they're finished. The accuracy has to be very precise, and it is quite feasible. But though I'm repeating myself, it's important to go to a center that has been doing that for a while and has documented experience doing it properly.
We talk about centers of excellence and interviewing the doctors before you go into treatment. For SBRT specifically, do you have a baseline of how many procedures would have needed to be done by this radiation oncologist?
I mean, that's a good question. The quality control question is just as important as what type of treatment you're going to pick, whether it's SBRT or brachytherapy or proton therapy. It's always a problem. It's like picking a good plumber, a good electrician. A lot of it has to do with word of mouth. If you are soliciting a center and someone's referring them, what's the credibility of that person? Do they have experience referring, or is it just because they had a good experience? All these things enter into the decision-making process, and there's no simple, easy answer. There are sometimes very reputable academic centers, but they always have the time when they're starting these new treatments. So all I can say is that ask questions and get consultation from multiple sources. Perhaps primary referring physicians that have a lot of throughput and have a lot of patients going. They can see the outcome afterwards, but there's not an easy answer for that.
So do you think online reviews are also a good thing to look at as well?
I would certainly look at them. We all struggle to find out what's really going on in these centers, and feedback from patients that have been there is important.
So in the same vein as radiation, there's a patient who has a doctor who says they don't use SpaceOAR, and they're kind of wondering if this is a red flag. So can you explain what SpaceOAR is and let us know, is it a red flag?
To me, it would be a red flag. The best doctors who are highly skilled can usually get away without rectal burns 95-98% of the time. I mean, they do very, very well. But who wants to even take a 2 to 3% risk that you don't have to take? The SpaceOAR now is covered by insurance, and if the doctor is skillful putting it in, it's not a big deal. And what this does is push the rectal wall outside the radiation field so that the dreaded complication of long-term burn to the rectal wall is avoided. This is a very exciting thing. I think it's one thing that's made, we talked about SBRT before, where they're giving large doses of radiation quickly over a 10-day period. It's made SBRT much safer. So the risk of SBRT without SpaceOAR was probably a little bit higher chance of proctitis or rectal burns. That's the technical name for it. And proctitis that doesn't heal is really a dreaded complication. So a simple intervention with SpaceOAR takes that risk away. And I don't understand why a competent physician wouldn't want to minimize the risk of proctitis as much as possible.
Yeah, I know when I first started taking helpline calls, I got my first call with somebody who had permanent radiation burns, and it was awful, like the side effects of that. So when SpaceOAR came out, like a year later, I was pretty excited about it. But thank you. I think it's a very important thing for patients to pay attention to. Hey everyone, it's me, Alex, and our mascot Hunter. You can check out his Instagram, Sir Hunter the Dow, at the link below. Don't forget to subscribe to our YouTube channel, and in fact, if this dog high fives me, high five,
Can you high five me? Thank you. You have to subscribe. Go subscribe to the YouTube channel. He even thinks it's awesome. Also, don't forget to visit our website, pcri.org.